Welcome back. In this video we'll talk about the most common causes of hip pain and the treatments. We can classify the causes of hip pain by different symptoms. For example, if a patient had sudden pain in their hip that came immediately after having intense exercise or repetitive exercise, this is most likely associated with hip strain or muscle strain. In this case, all you have to do is rest, have some ice packs applied to the hip, and have some compression wraps around the hip. No need for any other medications or any other management. This should be enough. And if the hip pain was associated with a swollen hip joint that appears to be warm or hot, and it can also be tender when touching, this can indicate a joint infection, which we call a septic arthritis. In this case, the patient most likely needs to be admitted to the hospital and take antibiotics intravenously. We can also do aspiration to take some of the pus inside the joint. This can be especially helpful in determining the infective organism and guiding the antibiotics treatment. If a patient had severe pain that started after having a pop sound or after having some trauma, this is most likely a hip fracture, and the pain can be very severe and associated with nausea or vomiting. Understandably, this will limit the patient's movement and they cannot walk, and of course they need to go to the hospital immediately. Some older patients, especially older than 45 years old, will have a pain that increases when the patient walks, and it can also be associated with stiffness. This is most likely osteoarthritis. On the other hand, if the pain was present but improved when the patient started walking, so it's the opposite, this is most likely indicating of rheumatoid arthritis. Both of these conditions require very specific treatment that you need to see your doctor for them. In any case, you need to see your doctor if the pain was very severe and limiting your movement, or if the pain was only getting worse and not improving, or if it was associated with stiffness in the morning that lasts for more than 30 minutes. Some of the good pain medications that you can take over the counter include meloxicam and ibuprofeno and maybe paracetamol. Alright guys, that's all I have. Thank you so much for watching. If this video helped you in any way, don't forget to subscribe, and I'll see you guys later.